Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you're listening today. What if your most accurate fertility tracker isn't a gadget or a device, but a daily low-tech biomarker that you are already having? Today, we're going to translate cervical mucus into plain language, what the different types mean, how to observe confidently, and how cervical mucus can guide both conception and cycle-timed labs without stress. So let's get started, as always, with a patient story about Tara. Now, Tara came to us as a nurse who was working 12-hour shifts, and she was new to fertility awareness tracking. She was feeling quite overwhelmed by conflicting advice that she had received online, and she's not sure what she's seeing is discharge or mucus or fluid or how to find her fertile window. She worried she was doing it all wrong. She had downloaded a couple of different apps that were trying to predict when ovulation was and found that she got quite frustrated with them. She also went and bought an expensive femtech device and also felt as though that was not very clear for her. She finally had a friend tell her to book an appointment with one of our charting instructors to help make sense of it all. So when she came to see us, we noted that Tara had cycles that were fairly regular, 29 to 30 days apart. She did notice some days that she reported a damp feeling and occasionally a slippery sensation, but she wasn't sure how to record it. Again, with her work as a nurse, she had long shifts, sometimes had a hard time getting enough water in, and we also noted that she used certain medications during allergy season, like antihistamines, to help dry up her sinuses. After one coaching session, Tara felt more confident on how to standardize checking for cervical mucus, how to record it, and also got guidance on making sure she had plenty of good fluid hydration throughout the day. Her charting instructor also referred her to see me for some other options regarding her antihistamine medications, as this can sometimes unnecessarily dry up cervical mucus observations as well. Within the very next cycle, Tara was able to clearly distinguish her non-fertile from her fertile cervical mucus. She was able to time intercourse more confidently in order to know her fertile window, and most importantly, had a better understanding of exactly when her time of ovulation was in order to improve her chances of fertility and to time her labs appropriately during her luteal phase. No more temperature monitoring, no more timing urine tests, no more expensive devices or strips, and she now felt as though she could put it all together. So what does cervical mucus actually tell us? We utilize cervical mucus because it is a hormone-responsive biomarker. When our bodies are secreting more estrogen, we have more abundant, more clear, slippery, or stretchy cervical mucus or fluid that supports sperm survival and transport. After ovulation occurs and the egg is released, progesterone starts to increase, and that will dry up or thicken mucus, which creates a barrier at the opening to the cervix that signals the end of the fertile window. Now, cervical mucus is incredibly powerful because it reflects to us in real time what is going on with your body's hormones. It does not rely upon considering last month's average or when did I ovulate last month or what was happening at that time. We use it to see what is happening today. We also are able to utilize that cervical mucus in order to guide conception timing and then to identify appropriate timing for lab testing after ovulation has occurred. Now, if you don't see cervical mucus, then there may be something else going on that would indicate an abnormal hormone imbalance. Or maybe you are dehydrated and not getting enough fluids, or perhaps there is some underlying infection or medication effect that is playing a role. So not having cervical mucus present can also be an important sign that your body is needing some assistance with figuring out how we get things back to more healthy. Now, not all moisture or discharge is considered fertile cervical mucus. In fact, there is a big difference between normal vaginal secretions and normal cervical fluid. Oftentimes, you can also have confusion if there is arousal fluid or residual semen present from intercourse the day before or earlier in that day. Standardizing observations can help you to categorize things accurately. So how do we teach you how to observe cervical mucus? And really, this is a simple, consistent, and repeatable task that is easy to do for anyone. So the general theory behind this is that you are going to do an external wipe. This is not an internal vaginal check, but an external wipe with toilet tissue before and after every bathroom use. You're going to pay attention to the sensation you have as you wipe across the vulva. So is it dry? Is it damp? Is it slippery? And pay attention to this throughout the day because it can change. We also then ask you to do a visual check of that toilet tissue each time. Look to see if there's anything on the tissue. If there is no mucus, then you are done with your observation and move on. If you do notice that there is mucus or discharge on the tissue, note if there is any stretch to it. Can you lift it off of the toilet tissue with your finger? Does it go 1 centimeter, 2 centimeters, longer, shorter? Is there any color to it? Is it clear? Is it cloudy? Is it white? Is it yellow? And then finally, what is the consistency? Does it seem to be sticky or tacky, or is it more that slippery egg white? What you do then is at the end of your day, you record your most fertile sign of the day. Again, not every single wipe, but the most fertile sign of the day. So the fertile signs that we're looking for are slippery if you wipe, clear if you're looking at the color of it, and lubricative, or meaning that it is easily wipeable, and if there's any stretch to it. Now, any of those signs are going to be identifying of fertile type mucus. In our clinic, we prefer to utilize Chart Neo as one of the only apps out there that allows you to chart your biomarkers in real time rather than predicting when ovulation happens. The other reason we utilize this app is that it is currently one of the only apps out there on the market that allows you to share your charting data in real time in a HIPAA-secure fashion with your healthcare team. Now, we recognize there are many other apps out there on the market, but again, if your app does not allow you to enter your data in real time, that can be a big problem. If it is trying to just predict when ovulation is happening, that's not going to be very accurate for you. Now, what are some common things that we want to consider when you're evaluating for cervical mucus? Again, if you are not having much cervical mucus present or you don't identify it at all, first check to see, am I well hydrated? A good rule of thumb is to take approximately half your body weight in pounds, and that should be approximately the number of fluid ounces that you drink in a day. So for example, if you're somebody who weighs 140 pounds, you should aim for a minimum of 70 ounces of water per day. You also want to consider certain medications. So specifically, as we mentioned was the case with Tara, she was on antihistamine medications or allergy medications. Now, although these medications are great for drying up mucus that might be in your nose or your throat or excess itching in your eyes, it can also dry up cervical mucus in some individuals. Decongestants can do the same thing. And finally, some antidepressants also may reduce your cervical mucus observation. So important to discuss timing of your medications or possibly alternatives if that's an option for you. Other things that can make your observations confusing include the use of lubricants during intercourse. We always recommend choosing fertility-friendly, water-based lubricants. Again, use them sparingly, or in some cases, you may wish to avoid them during your actual ovulatory phase if you don't need them. This can help to make it more obvious what is actual cervical fluid and what might be leftovers from lubricants. And finally, if anything seems abnormal about your discharge, if there is any odor to it, if it's itchy or painful or chunky or has any yellow, green, or other colors to it, you want to make sure that you evaluate for things like bacterial overgrowth or yeast infections, rather than just labeling it as cervical mucus. And again, When we're looking at these cervical mucus observations, what we're looking at is trying to find what we call your peak day or the ovulation day. Your peak day is the last day of the most fertile quality cervical mucus that's present. So again, slippery, clear, stretchy, or best lubricative sensation. Any of those, the last day that you see those, typically aligns most closely with your day of ovulation. Now, we do oftentimes get asked, well, what about temperatures or what about LH monitoring? And although these methods can be helpful or useful, especially if you don't have a lot of cervical mucus, they don't align quite as well if you have other things that may be going on. So for example, if you are somebody who doesn't sleep well overnight, or you have a shift work, or perhaps you're getting up overnight to be with younger kids, temperature monitoring the next morning can be a bit inaccurate. The other issue with temperature monitoring is that when it identifies a temperature shift is after ovulation has occurred. So theoretically, you can confirm that ovulation has passed once you see that temperature shift, but in the time leading up to that, it can be more challenging to understand exactly when that fertile window begins. As far as LH monitoring, there's a wide variety as to the effectiveness and the sensitivity to LH monitors or other urinary hormone metabolite monitors. In some cases, they are only about 70% accurate, which means that 30% of the time you may ovulate, but nothing shows up on your LH strip. Or in some cases, I've seen where women's LH strips are positive for 5 or 6 or 7 days, and that makes it really challenging to narrow that down. So again, from a standpoint of ease of use, that's typically why we recommend as first line for most women, identification of cervical mucus as the most accurate, easiest, and cheapest option for identifying fertile window and tracking your cervical mucus, as well as fertile window and ovulation time. So how do we utilize cervical mucus for trying to conceive or for medical management? Now, if you are trying to conceive, we recommend aiming for intercourse on any days that are slippery or stretchy cervical mucus, continuing through 3 to 4 days after your peak day as well. Again, this isn't an exact science. There is nothing that says you must have intercourse every day or every other day or every third day. But typically we say those are going to be the days that are considered your fertile window, is any day that you have any of the clear, stretchy, lubricative, or slippery sensations that you notice with cervical mucus. Now, if you are somebody who doesn't have much for cervical mucus or it's confusing, we recommend starting with making sure you have enough hydration, maybe adding in electrolytes if you need to, and again, reviewing any medications or supplements that might be drying things up. Instead of antihistamines, we oftentimes can consider different supplements like diamine oxidase or transfer factor, which can help with excess histamine or allergens. Make sure that you discuss any of these supplements with your doctor to see if it's a good fit for you. We also sometimes will add in other supplements that can help with increasing mucus production, things like N-acetylcysteine or omega-3s. And most importantly, we want to make sure that we are checking with somebody who is knowledgeable when it comes to restorative reproductive medicine for checking mid-cycle estrogen levels, making sure, do I have enough estrogen that's around to even let that cervical mucus increase? Do I have problems with thyroid or iron deficiency that may be causing a role with ovulation impairment? And addressing any chronic inflammation or infections, especially if I'm noticing a continuous mucus pattern. Now, if we're using cervical mucus to help with medical management, again, so important to be able to identify specifically your day of ovulation in order to schedule labs to be done approximately 1 week after ovulation. We time this appropriately and precisely because that is generally when your progesterone levels will be at their highest peak during your luteal phase. If you have a shortened luteal phase or spotting that happens before your period, it is a good indication that there may be a problem with progesterone deficiency. And so we want to make sure that we are timing those labs appropriately to make the adequate diagnosis before just starting you on treatment. And finally, when it comes to understanding what is normal, what is an infection, Women that are used to tracking their cervical mucus and identifying that on a regular basis are very good at identifying when something is different or something is wrong. And in those cases, they're able to pick up on infections very quickly, whether it's bacterial vaginosis or a yeast infection, because they oftentimes are accompanied by other factors like odor, itching, burning, unusual discharge, things that are very distinctly different from cervical mucus. So let's wrap up here with our frequently asked questions. Number 1, I never see any stretchy mucus. Does that mean I'm infertile? Not at all. In fact, some women feel a lubricative or maybe a slippery sensation without seeing any actual stretch to their mucus. Sensation oftentimes matters even more than a dramatic visual mucus inspection. Walking sensation is also something that may be the only sensation some women notice. So for example, while they're walking through the day, it might feel more slippery, even if they don't notice that when they do their wipe test. I have seen cases over the years where women come in with a cycle that looks to be completely dry, meaning she didn't observe any mucus or see any sort of slippery sensation, where she still becomes pregnant. So no, it does not mean that you're infertile. It just may mean that we want to be considering if there is another sign that is more obvious for you. Second question, is egg white mucus the only fertile type? The answer here is no. Again, you only need to have one of the characteristics in order for it to be considered fertile type mucus. So it can be clear, it can be lubricative, and it can be slippery. Even if it's not stretchy, any of those signs can be fertile. And again, we're only needing to record the most fertile sign of every day. Another question we often get asked, do I have to use an app? I don't like to be on my phone, or I don't like technology. Apps are definitely optional. For many people, they find it makes it much easier to track things. Most people don't lose their phones all that regularly. But again, there are absolutely different paper versions of charting that you can utilize if that makes more sense for you. The skill and what we're trying to learn is in your observations. So being able to have those observations and correlate that, writing it down either on a paper chart or in an app, allows you to look at your trends over time and to share your data with your treating healthcare professional. And finally, I am seeing mucus for many days, or I don't notice any dry days at all. Is that normal? Now, some women do have a longer estrogen rise, and if someone has continuous mucus all month, there are other ways that we can evaluate to help discern when that fertile time is. However, we want to make sure that we're evaluating and checking for inflammation, infections, estrogen dominance patterns, cervical ectropion, or any other thing that may be causing that continuous mucus pattern. Oftentimes, if we treat the underlying cause, we're able to help make it more clear and more obvious when your actual fertile window is, rather than just observing mucus every single day. Imagine if reading your fertility window felt as simple as noticing a sensation and a single daily note, because you can learn a consistent method and remove the confusion. Over the course of a few cycles, timing is easier. Labs will be drawn at the right time, and your cycle can make sense in your own words and in a way that you are able to clearly communicate and share that with your healthcare professional. All of this is possible to help improve your health and promote fertility. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call and learn more about our package-based pricing for comprehensive care. We are currently able to see people for in-person appointments in our Cedar Rapids, Iowa clinic, or can arrange for a telehealth visit if you live in many different states across the U.S. Check out our website for current states that we can serve medical clients, and let us know if your state is not listed to see if we can still cover you there, as we are constantly expanding our reach. Please note that our fertility educators are able to take care of clients no matter where they live. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content that I look forward to sharing with you on our next episode of Cycle Wisdom.